Welcome to video blurb number 1, Introduction to Childhood Lead Poisoning Prevention Program's Lead Case Management. What prompts public health lead case management? A confirmatory blood lead test with a result of greater than or equal to 3.5 micrograms per deciliter prompts public health lead case management. What is lead case management? Public health nurses conduct lead case management, which involves working with families to identify a source or sources of lead exposure through telephone and site investigations, family education on lead risk and prevention, providing resources for nutritional and developmental screenings, providing referrals and recommendations for lead-safe practices, and working with healthcare providers. Case management continues until the child has a blood lead level less than 3.5 micrograms per deciliter. What is a telephone investigation? The telephone investigation process involves the lead case management public health nurse calling the parent of a child with a blood lead reference value greater than or equal to 3.5 micrograms per deciliter, asking a series of questions during the call to try to identify the source or sources of lead exposure, and providing recommendations to reduce the child's exposure to lead. What is a site investigation? A site investigation looks for high-risk sources of lead using an XRF or lab samples. Situations that might prompt a site investigation include an older home built prior to 1978, any recent renovations done to an older home, if a family has purchased and consumed spices from an international country, if a family has brought imported goods such as silverware or cookware from outside of the United States, and if the child's blood lead level does not decrease after a telephone investigation. What is included in the plan of care? After the investigation, a plan of care is developed for the family and provider. The plan of care includes a summary of the child's blood lead level, when the child should have their blood lead level retested, a list of possible sources of lead exposure, steps to take to eliminate or minimize lead exposures from the possible identified sources and to prevent exposure from other sources, nutrition recommendations to reduce lead, educational materials, and notation of any indicated referrals. Thank you for watching this video. For more information, visit snowhd.org/lead.